Hello everyone, my name is Lupșea Florina and I'm a third-year student at Cluj School of Public Health. Today I will present my research study called The Impact of Leadership Style on the Work Engagement, a pilot study performed in public hospitals. In the following minutes, I will discuss about my background, methodology, objectives and hypotheses, results, limitations of my study and also some implications. I will start with an overview of the subject. I will define work engagement and each leadership style involved in the study, and I will explain the components of each concept. The Romanian healthcare system is facing a number of challenges due to the insufficient budgets allocated by the government. Therefore, frustration, job insecurity, anxiety regarding the future can frequently appear and lead to work disengagement. All these feelings represent a strong disadvantage for the healthcare organizations because work engagement is associated with higher productivity, profitability, and patient satisfaction. In order to maintain the engagement of the employees, are required leaders that have a high influence, charisma, vision, and more exactly, transformational leaders. Transformational leaders are proactive. They seek to optimize individual, group, and organizational development and innovation, not just to achieve performance at expectations. They convince their associates to strive for higher levels of potential as well as higher level of moral and ethical standards. Transformational leadership has 5 components. The first one is the idealized influence. The second component is the idealized behavior. The third component is the inspirational motivation. The fourth component is the intellectual stimulation. The fifth component and the last one is the individual consideration. Further, transactional leadership defines expectations and promotes performance to achieve these levels. Contingent reward and management by exception are 2 core behaviors associated with management functions in organizations. The last style of leadership is the laissez-faire or the passive avoidance style. Passive leaders avoid specifying agreements, clarifying expectations, and providing goals and standards to be achieved by the followers. This style has 2 components, the management by exception, the passive form, and the laissez-faire component. Our last concept is the work engagement. This is defined as the harnessing of organizational member selves to their work role. This approach emphasizes that the personal engagement of the employees implies ways of expressing themselves physical, cognitive, and emotional during their role performances. This concept has 3 components, and these are vigor, absorption, and dedication. The main objective of the current study was to determine the impact of the leadership style practiced by the hospital managers from Cluj-Napoca on the work engagement of their subordinates. The first hypothesis was the leadership style of the managers will be more transactional than transformational or laissez-faire. The second hypothesis was the leadership styles of the managers predicts the level of their subordinates' work engagement. More exactly, the transformational leadership will be associated with high and very high levels of work engagement, and the transactional leadership will be associated with average level of work engagement, and laissez-faire will be associated with low and very low levels of work engagement. A cross-sectional study was conducted in 3 public hospitals from Cluj-Napoca. The participants were recruited through a convenient sample method, and the collection of the data was made through self-administered questionnaires. The multi-factor leadership questionnaire 5X, the 360 degrees evaluation, was used for assessing the leadership styles of the hospital managers, and the Utrecht Work Engagement Scale was used for assessing the work engagement level of the employees. Descriptive and inferential statistics were performed for analyzing the data. The predominant leadership style of the hospital manager was transformational. The self-evaluation of all the managers registered higher scores compared with the peer evaluation. Regarding the work engagement, the responses of the employees of the gastroenterology and hepatology hospital and the rehabilitation hospital showed a high level of work engagement, and the ones from the municipal hospital showed an average level of work engagement. Our first hypothesis was not confirmed. However, the second one was mainly confirmed. In the case of the rehabilitation hospital and the gastroenterology and hepatology hospital, the transformational leadership was associated with high levels of engagement, and in the case of the municipal hospital, the average level of work engagement was explained by the lowest rate of transformational leadership and the high rate of transactional leadership. If we compare the pilot study included only 3 hospital managers for self-evaluation and 100 subordinates for peer evaluation and work engagement rating, fact that affects the representativeness of the sample. However, it's a good start for the further studies that analyze leadership style and work engagement from the Romanian public institutions. Given the significance of the subject, are recommended further studies that have representative samples and also studies that can ensure the validity of the Romanian version of the multi-factor leadership questionnaire 5X, the version of 360-degree tool designed by Bast and Avolio.